liquids that is given to replace water, sugar, and salt that is needed for the ill patient or a patient having an operation or a patient cannot eat or drink. It is given straight through a drip, through a IV drip. So intravenous fluids, so from the word intravenous, so IV drip good siya. So the uses of IV fluids, it is to prevent or treat dehydration. So as you can see the picture, mao ni ang mga symptoms sa dehydration: thirst, dry mouth, rapid heartbeat, headache, dry skin, and decreased urination. So IV fluids is used in all ages who are sick, injured, dehydrated from exercise or heat, or undergoing surgery. So these are this contains electrolytes also that are minerals in your blood and other fluids that can carry an electric charge. So this is common IV fluids is commonly used in hospitals. So intravenous rehydration, this is simple, safe, and common procedure with a low risk of complications. So hospital uses IV fluids to replenish the loose fluids, replacing ang mga na-loose na fluids for the patient using during chemotherapy, dialysis, kanang mag-flushing, and delivering medications like mga dextrose, like and mga NSS, mga plain NSS, mga na gamiton to deliver medications like kanang ilang gimix nila as a diluent. So mao na ang IVs. So IV fluids, it is made of what IV fluids made of. So all of our drip IVs start with sterile saline water solution. So dapat sterile gid siya and all are mag-start gid siya sa saline water solutions. It may contain ang IV fluids may contain vitamins, minerals, and medications. Kaya pwede siya himuong diluent, pwede po siya adan o vitamins as a vehicle ang IV fluids. And IV fluids, this combines sodium chloride and sterile water. So ato lang na i-explain later on. And saline solutions uses 0.9 sodium chloride. So mao na ang saline solution, 0.9% sodium chloride. So we all know that sodium is used for tissue repair, blood pressure balance, and muscle and nerve support. So ang sodium play an important role gud siya sa content sa IV fluids. So during dehydration, a patient may have a mental confusion and aching joints. So during dehydration, ang mahitabo ana is dahan man kang na loss of fluid. So the tendency is increase ang sodium. So once increase ang sodium, a patient may experience seizure and convulsions kay musaka na siya sa brain. Too much sodium can cause seizure and convulsions. That's why i-correct gyud dayon ng dehydration through giving IV fluids. So mao na ang sa hospital most common gid ana sa mga bata. For example, guys, kanang sa ma-dehydrate ang bata. So dapat need gid na siyang idalon dayon sa hospital kay mao na magka-cause nga seizure or magka-convulsion ang baby tungod kay increase na ang sodium. So the term for medical term for increased sodium is hypernatremia. So during hypernatremia, a patient may experience extreme thirst, dry mucus, and dry flushed skin and weakness. So magluyag yun. So of course, what do fluids do you do to your cells? So the process is called the osmosis. So osmosis is the important mass transport process. This happens when solvent molecules move through semi-permeable membrane from a dilute solution to a concentrated solution. So this transport, the osmosis, is regulated siya by osmotic pressure. So what is osmotic pressure? It is a pressure which prevents the inward flow of water across a membrane. It protects a cell from taking in more water that it can handle, which would cause the cell to burst. So, need gyud ang osmotic pressure so that ang cell neither shrink nor swell. So, ang osmotic pressure mao ni siya ang minimum amount nga mo prevent ra siya murag iya rang equal, there's a equilibrium gyud sa cell nga dili gyud siya walay mo flow, wala po'y too much nga masulod sa cell. So importante ang osmotic pressure. So mao ni ang, as you can see the picture, so there's a water molecule, then it passed through the semi-permeable membrane in a concentrated solution containing a low concentration of water molecules. So ikumpara siya with osmotic pressure, balance lang yun ang iyahang flow. So walay paano gud siya, equal lang gid siya because of the osmotic pressure. So kaning nasa taas nga picture guys, mao po na iya ang process ana mao na ang katong osmosis nga ni pass through siya through a semi-permeable membrane. Then a fluids can be crystalloids or colloids. So crystalloids, these are small molecules that easily fit across semi-permeable membrane. So from the words padaan guys, crystalloid, so nanadain tayo hint na small gid siya, so small molecules. So it increase fluid volume and in the intravascular space. So ang crystalloids mao ni siya pwede siya mo tako lang ta ani ang example ani. So I will discuss that the crystalloids mo ni siya maka-increase sa fluid volume sa cell without disturbing the other extravascular, intracellular space. So pwede siya matreat for hypovolemia. So what is hypovolemia? It is the loss of plasma. So pwede po ang crystalloids for burns and trauma. So later on, we will discuss the example of crystalloids and will explain to you nganong pwede siya sa hypovolemia. And next is the colloids. Colloids are larger molecules, thus they do not cross the semi-permeable membranes. These only remain in intravascular, remain in the bloodstream rather than entering your cells. So dili gyud siya mukuan makasulod sa naaragod siya sa gawas gyud, naaragod siya remain in the intravascular since larger molecules man siya. So one of the example of colloids is the plasma expanders. So the function of crystalloids is to expand the intravascular volume without disturbing the ion concentration or causing the significant fluid shift between intracellular, intravascular, and interstitial space. So, iyang function is kana iyara go inormalize tanan ang intracellular, intravascular, and interstitial spaces. Then, there are three types of IV fluids. These are the isotonic, hypotonic, and hypertonic. And so isotonic, it is there's no concentration gradient across the cell membrane, which means that your cells neither expand nor shrink. So isotonic, from the word iso meaning equal, like equal lang rin siya iso. So this maintain osmotic pressure on the outside and the inside of the cell. So mao na tong akong gidiscuss bag-o lang na ang osmotic pressure important siya to maintain ra gyud sa cell. Mao nang this kaning isotonic mao ni ang equal lang ang iyahang sa outside and inside the cell. So it is the amount of water transferred into the cell is equal to the amount of water transported out from the cell. So solute concentration inside the cell equal to the solution outside the cell. So hint lang yun na if kung makadungog mo isotonic from the kuan nga root word lang nga iso, diha na ganinyo maka-understand na gyud mo nga iso, so equal. So equal lang gyud ang iyahang in and out of the cell. So mao ni one of the example of isotonic is 0.9% sodium chloride, the NSS polyamp, lactated ringers, the color blue one, the ringer solutions, the 5% dextrose in water, the red one. So, and hypotonic, so next is the hypotonic. So the water will rush into the cell, causing to expand. So, ang water, ang solvent, moadto na pud siya sa cell. It does mo create siya swelling. So, patient who receive this solution have to monitor for hypovolemic shock and hypertension. So, dapat dili ang hypotonic dili gyud siya angay gihatag sa hypovolemic shock. So, hypovolemic shock guys kanang there's a massive loss of blood plasma. So, and dili po siya pwede sa hypertension kay ngano man ang hypotonic mosulod man ang water sa cell. So, it can increase the sodium. So, once increase ang imuhang sodium, so ma-exacerbate ang hypertension. So, ikis na gyud na siya. Di gyud siya balantayan gyud na ihatag sa hypertension patients. And for hypovolemic siya kay wala na kay loss of fluids naman ka sa imuhang cell. So, dili gyud siya pwede sa hypotonic. So, hypotonic, mao na ning makita ninyo sa picture, the cells inflate and eventually burst kay ang water nisulod naman siya tanan sa cell. So, ma-burst gud siya tungod sa kadaghan. Mao na the water is transported into the cell, mas taas gud ang water nga nisulod sa cell, mao nang hypotonic. So what will happen when during hypotonic? The cell will swell. Swelling mo expand gud hypotonic. So ang hypotonic solutions contraindicated po siya sa patient with increased ICP. What by is the cranial pressure as kaya ma-exacerbate ang effects sa cerebral edema. During ang cerebral edema, guys, imong ICP ana increase. So, nag-swell gyud ang imong brain ana. So, dili gyud siya pwede ang hypotonic kay muswell pa noon. So, maoning it may be exacerbate the effects of cerebral edema. So, dili gyud pud pwede siya sa patient with cerebral edema. So, example of hypotonic is the 545 solution, 0.33% sodium chloride, wala man ta ani. 0.2% sodium chloride, wala po ta. 2.5% dextrose water, wala ta. But ang most common lang gud kaning usa, ang nasa hypotonic guys, 0.45. The 545, the violet one. Hinamdumi ang color guys. So another example po sa hypotonic is the QCl na amantaan na. So the use of potassium chloride, the polyamp katong orange guys, dool siya sa mga NSS polyamp of D50, it prevents or it can treat the low potassium levels in the body. So potassium, it is a mineral that your body needs for proper functioning of the heart, muscle, kidneys, nerves, and digestive system. So, ang potassium needs siya sa heart para mo proper beating pud na. So, once the potassium is increased, there's a chance na mag irregular heart beating. So, the lethal dose of potassium is 150 milligrams per kilogram. So, if kung increase na kayo ana, makakos na siya og cardiac arrest. So mao nang balantayan gyud ang KCL. Kuan lang gyud na siya slow IV slow IV lang yun ang iyahang infusion guys. So usually ana if kung mag-incorporate ang nurse ana nutan gyud na nga nutan gyud ng kuan fluids ana na ginay fluid hanang magbitay gani ka na sa dextrose butangan guna nila kuan do not anang push infusion kay kuyaw kayo if kung naay ma-chance nga ma-increase na ang dose makakos gid siya cardiac arrest so makapatay na nuan taog patient. So next is hypertonic. So kaning hypertonic, water will flow out of the cell causing to shrink. So mo shrink siya kay ang water ni gawas na po siya sa cell. This is risky because this can result in intravascular fluid overload and pulmonary edema. So dili po siya pwede. Ang hypertonic solutions, balantayan po siya sa patients with ganang na ay mga COPD and mga na ay pulmonary edema since it can increase the fluids in the intravascular. So, digid siya pwede man, usually ang doctor mo gamit mag-hypertonic but it cannot be used in an extended period of time. Kaya na ay chances nga makakause siya o mga maka-exacerbate siya sa patient nga na pulmonary edema and it can cause anong fluid overload. So mao na ang most common examples sa hypertonic saline solution. So ang saline solutions kay naa siya different kinds guys. 0.9% na ata ani kaya ang NSS polyamp. 0.9 sodium chloride. Okay, sorry. Ang 3% sodium chloride, wala ta hasaning 5%, but nagpangita pod sila aning 3% sodium chloride. Wala ta ani. Then, dextrose solution 10%, the D10% water, the D20% water, the D50 water. So naataan D50 atong color red, katong D50 polyamp pyramid mao ni. Then dextrose 5% and 0.9 normal saline, D5 NSS. Sa una naani siya guys color green, like nani siya D5 then 1/2 NSS gyud siya. Karon wala naman pud diri sa hospital. But sa una na agid ni kasa ning dextrose 5% and 45% normal saline. Then the 5LR, pink, ang pink. So, common lang yun na ato is NDI 5. Ora yun guys. But ako hindi pa niya ang usually hypertonic solutions. But ang most common na ginagamit, mauning D5NSS, the D5LR, and the D50 water Euromed. Na-explain na ako to hypertonic. So, there are four main types of IV fluids: normal saline, half normal saline, lactated ringers, and dextrose. So normal saline, it is example ani is plain NSS, 10% normal saline or the 0.0 plain NSS hatong 1 liter plastic, 1 liter glass, 500 plastic and 500 glass, and the NSS polyamp. Normal saline na siya. It is isotonic. So also it is also a sterile and non-pyrogenic fluids, and this commonly used most often used siya to increase the volume of circulating the plasma, and use siya sa ang uses niya is for blood transfusion, fluid replacement during na diabetic ketoacidosis, metabolic alkalosis, hypercalcemia, and hyponatremia. But kani common gyud siya diri sa hospital. Ang normal saline gamiton siya sa guys, normal solution blood transfusion kay since isotonic raman siya. So mas dali ang pag-flush out during blood transfusion kay since isotonic dili ra gyud maka-cause og mga embolism unlike sa kanang naay mga sugar, other minerals na fluids if mo gamito siya siya sa after and before blood transfusion, makakos gyud sa og mga embolism. So, ang ginagamit gyud used only gyud ning cleanliness is for blood transfusion gyud, no. Akong ginote diri only fluid that can be used in conjunction with blood administration ang normal saline. Half normal saline, this is hypotonic. Example is it is a 45% normal saline or 0.45 sodium chloride. Ang naa nato is D545, color violet. Usually ginagamit sa baby or sa patients having a diarrhea. Why? Because it is a hypotonic. And mao ni ang ginagamit kay since during hypotonic increase naman imong sodium, so kuan gyud niya ang depletion sa ang increase sa sodium equalize ra gud siya. So half the chloride concentration is normal saline man. So patient suffering from cellular dehydration pod, mao po ni ang ginagamit. It can raise your overall fluid volume, water replacement, and sodium chloride depletion, gastric fluid loss, and decay after normal saline and before dextrose infusion. So most common good niya is kanang patient suffering cellular dehydration. Anang dehydrated good ang patient, di 545 good ang ginahatag katong violet. So maunay common good lagmit good siya nga ma-dispense sa ER o sa pedya kay mao man ay ginagamit sa mga baby nga dehydrated. So half normal saline, always avoided in patients who have burns, liver diseases, or trauma as the solution depletes intravascular fluid level. Since hypotonic man siya, so ang water mo mas daghan man mo ato sa cell. So dili gyud siya pwede sa naay mga burns, liver diseases, or mga trauma. As the solution depletes the intravascular fluid level, so mo samot gyud. So dili siya pwede. Then next is the lactated ringers. This is highly common IV fluid used in fluid resuscitations. Alternative niya is normal saline. So if kung wala ang PNNS, ang alternative niya katong color blue, the plain LR, lactated ringers. Lactated ringers, take note guys, please. It contains chloride, calcium, and potassium. So, upat ang content sa plain LR color blue guys, take note. And the additional of electrolytes ana napod siya buffer which is the lactate. Mao nang isotonic siya because the lactate makes the ringers isotonic. So, if kung wala ang normal saline, katong plaininess is, alternative is isotonic. So, mo na tong similar to the body's natural plasma and serum concentrations kay isotonic. And plain LR also called Hartmann's solution. So, contain siya og potassium, calcium, and lactate, sodium, and chloride. Take note the content and the other name of lactated ringers and the color. Burns. Pwede. Nawala ang connection. Sorry, Kevin. Nawala. Sige. Hello? Guys, naapa mo, Kevin?
Ma'am,
Kevin?
ma'am.
Okay, sige. Unsay color gani sa plain LR, Kevin?
Color blue.
Ha?
Color blue.
Asa dapit na palong ko sa akong report, Kevin? Wala. Kevin?
Lactated ringer, ma'am.
Lactated ringers na. Unsa may color sa lactated ringers gani, Kevin?
Color blue, ma'am.
What's the other name?
Um, Heart, Heartman solution.
Okay, nanimati good ka. So, mao na to, ayan uses for dehydration, burns, hypovolemia, replacement of fluids, pH buffers, kay since contain siya og lactate. So, contraindications. So, take note, the most important sa plain LR, yung contraindications is dili siya pwede sa renal failure or na renal complications since it contains potassium. So, contraindicated man na sa hyperkalemia pod. And also, dili pod pwede ang plain LR or pwede siya but balantayan lang gid siya gamiton with patient with liver disease. Why? Because ang lactate ma-metabolize siya sa liver. So, dili siya so how can ma-metabolize ang lactate if na liver disease ang patient? So, dili gid siya pwede. And also, dili po siya pwede sa patients having a pH level greater than 75. So, sorry, wala. What is dextrose? So, dextrose, it is a simple sugar. The dextrose, it is identical to glucose. It's important because kaning dextrose, pwede po ni siya use as vehicle, like i-incorporate siya sa other medicine since dali man gid siya ma-absorb sa atong lawas. So, dextrose, same siya sa glucose, in which your body can quickly make use of it for energy. So there's three main versions of dextrose: the dextrose in water, dextrose in saline, and dextrose in lactated ringers. So mao ni ang atong 5% dextrose. This is hypotonic, guys. Unlike sa katong D50 katong polyamp, unsa man tong D50 polyamp, Kevin?
Hypertonic, ma'am.
Wow. Oh, lahi ni siya ha. Kay 5% dextrose water man ni, then ang atong 50 man to, 50% man to. So, hypertonic to siya. Ayaw mo kalibog kay katong basi maglibog mo aning 5% dextrose in water. Pero same ra sila nga red. Ang ilang kalahian ra is the content of the dextrose. So, dextrose in water, it is a crystallized solutions not used as fuel resuscitation for hyperglycemia. Why? Kaya ma-exacerbate na nuan since it contain a dextrose similar to glucose. So, pwede po siya treatment for diabetic patients who are not eating anything by mouth. And it can use to raise your total fluid volume, rehydration, hypernatremia, diluent for prepared injectables, medications for an IV. So, mao to akong explaining mo the most important thing sa dextrose in water is use gid siya as kanang vehicle, kanang mga injectable medications, kuyog i-incorporate gud na lagmit since ang dextrose is dali ra siyang ma-absorb sa atong lawas. And then, if kung ang dextrose kanang ihang ang dextrose nga gi-incorporate is since dali ra man siyang ma-absorb, so ang katupong medications ato nga gi-incorporate dali ra pud siyang mo absorb, then take effect na dayon. Next is dili pud pwede ang take note lang pud sa dextrose in water. Mas avoided siya sa patients with cardiac problems, renal failure, and increased ICP kay it can increase the fluid overload. So, kanang naay mga edema, dili contraindicated po ni siya. So, dextrose saline, mao na tong 5% dextrose in normal saline. Hypertonic lang siya when the dextrose is absorbed, but kanaragong sa iyaharagong kanang iyaharagong 5% dextrose gyud nga wala pa gyud siya gigamit, mao na to siya nga hypotonic. So not used siya sa patient with renal or cardiac complications since can cause heart failure or pulmonary edema. Next is dextrose in lactated ringers. It is sterile, non-pyrogenic solution and uses fluid and electrolyte replenishment. So unlike the others, isotonic siya when absorbed. When absorbed, ha? So, ang mga IV fluids po guys, na po siya mga complications. So, I will not, dili na nako, good na ko i-dig deeper, but I will show you some nga mga most common. Mao ni ang kani una is air embolism, also known as gas embolism. So, the IV pushes too much air into the vein. So, mas increase ang air. Wala ra po na kayo na tarong nila. Then, either pud aning cause pud nga too much magamit og IV fluids is kana mga collapsed veins kani mo kuha na gani siya color green. So the needle is inserted or when an IV is in place for a long period of time kanang dugay na kaayo. So ang kuan pod ana para mawala na pod sa pikas na pod papahuwayon kay mao nay cause collapsed veins, then fluid overload kanang like edema na murag ni swell na gyud siya, there's too much fluid, so mao na tungod is given too quickly, so mao na makakos na gyud po na siya sa patient of headache, high blood pressure kay too much fluid, so high blood pressure, so increase fluids, increase sodium, so increase blood pressure. So, ang resolution ani is adjustment of fluids lang. Then, naapoy hematoma. The blood leaks from the blood vessels into early tissues. Looks like a bad bruise and usually goes away in a few weeks. So, mawala rin yung like, bunol good siya, guys. Hematoma. Then, infection. So, most common, kanang wala na limpyuhan og tarong or ang needle inserted wala na limpyuhan or not sterile da itong fluids nga nahatag. So, ang iya resolution ana give antibiotic. Next is infiltration. If the needle moves or gets dislodged, fluid can enter tissues around the vein. So, causing stinging and bruising, nagmalagaang nagid kayo siya. So, infiltrations of fluids gini sa imong veins. The next is phlebitis. Vein becomes swollen because of the IV fluids. This can be treated by removing the IV. So, papahawayon sa gitna. Paggamit of IV fluids and then applying a warm compress and elevating the arm. So, next is, ayaw lang kayo labaran ninyo itong mga, marara itong mga example, most common nga mga complications na long period of time gamit sa IV fluids. Next is TPN. So, naata diri. So, this is a method of feeding that bypasses the GI tract. It is a special formula given through a vein that provides the most of the nutrients the body needs. The method is used when someone can't or shouldn't receive feedings or fluids by mouth. So, kato na gud ning dili na maka kuan swallow gyud. So, we will give TPN. So, take note po guys, kaning peripheral nutrition, this is delivered through a smaller peripheral vein, perhaps in your neck or in one of your limbs. So, from the word peripheral, so sa imong periphery good siya. So, small lang yun ni, smaller peripheral veins, peripheral nutrition. So, it is used to provide partial parenteral nutrition lang temporarily using the quicker and easier access of the peripheral vein. So, lang gini siya guys, temporary ang PPN. Ang CPN, Central Parenteral Nutrition, given siya in a through central vein, usually the superior vena cava, located under your collarbone. Diha man ang makita ang dakong ugat, which goes directly to your heart. The larger central vein allows a larger catheter to deliver higher concentrations of nutrients with high calories. So high calories ang content aning mga CPN, Central Parenteral Nutritions. Next is enteral nutrition. It is a method of feeding that uses the GI tract to deliver part of or all of a person's calorie requirement, normal or a diet or tube feeding. So, kani sa tiyanan na ang enteral nutrition. So, ang one of the examples sa naa nato nga TPN is Invitin A. It contains the fat emulsions, amino acids with electrolytes and glucose. So, ang uses ani is mga severe blood coagulation disorders, congenital disorders of amino acid metabolisms, severe renal insufficiency without any access of hemofiltration or dialysis, acute shock, and for peripheral or central veins. So, kaning MG10A pwede siya as kuan pod quicker sa peripheral or central veins depende na ni sa doktor. So, pwede po siya kaning sa mga naay kuan amino acid metabolism kanang congenital disorder of amino acid metabolism kay nag-contain man pod siya og amino acids. So, naputay Combiflex. Contain ni siya og lipid emulsion plus amino acids. AA is amino acids, guys. Plus electrolytes plus glucose. Uses, it is a parenteral nutrition for adults and children above 2 years of age when oral or enteral nutrition is impossible. So, gamiton ang Combiflex. Next is amino acids. So, take note what do amino acids do in our body. Take note, anak guys. And amino acids, it is the source of protein synthesis in patient needing IV nutrition. So what is the building blocks of protein? It is the amino acids. So amino acids do in our body is to break down food, grow and repair body tissue, make hormones and brain chemicals, provide an energy source, maintain healthy skin, hair and nails, build muscle, boost your immune system, and sustain a normal digestive system. So amino acids contain non-essential and essential amino acids and conditionally essential amino acids. So, wala siya nako gibutang diri kung kinsay na ni gid nako karon na ako'y mnemonics basin kabalo ra pud mo daan ani mnemonics sa kaan essential amino acid is PVT timhol, P phenylalanine, V valine, T tryptophan. The team is the threonine, isoleucine, methionine, the whole, the histidine, arginine, lysine, and leucine. So, PVT team whole. Mga example sa essential amino acids. Non-essential amino acid is kanina pud ko basin og kabalo na pud mo ani guys. But ingnan ako guys if paspas ako ha sa mnemonics kay gamit gud kayo ni. So, Kevin, unsa ganitong kuan mnemonics sa essential?
Akong na-absent ma'am kay PVT, Tim,
Hall.
Hall. Thank
Oo.
you, ma'am.
PVT Team Hall. TIM dayon space hall na HALL. Nakuha lang. Then
Yes,
ang
ma'am.
non-essential amino acid na ako'y mnemonics pod kani basin og pwede pod inyo na i-note guys, isulat ninyo guys. Taas-taas ni kaning napo ko wait sa guys. Almost all girls
Excuse me, ma'am. Nawala ang audio, ma'am.
kasi dumaan ako ba Sige daw. Hello guys, nawala. Asa na ganita?
Amino acids pa ma'am nga non-essential nga ni
Hello? Guys, pwede tingog sa para to check ra if kuan mo mo na ako.
yes
Good afternoon, ma'am.
ma'am.
Anyone? Kevin?
Yes ma'am. Good afternoon ma'am.
Kadungog ra?
Yes ma'am.
Oo. So as nakuha ano acids?
Ag sa mnemonics ra sa non-essential wala pa ma'am.
Wala. Putol-putol gyud. Sige, akong usbon guys ha. Maghinay ra ko ha. Sa non-essential amino acid, ang mnemonics dapat makabalog yun po mo aning mnemonics guys. Kaning non-essential and essential kay gamit man gyud pud kay ni siya. So ang non-essential mnemonics is almost all girls go crazy after getting taken from PROM shopping. So i-capitalize siya ng tanang start niya nga almost all girls guys. So the first ana almost stand for alanine, all for asparagine, girls for glutamate, go for glutamine, crazy for cysteine, after for aspartate, getting for glycine, taken from tyrosine, prom for proline, and shopping for serine. So, nga itawag siya og essential amino acids. So, it is because it must have to taken through diet since dili makaproduce ang ato ang own body. So, mao na tong ang example is the histidine, isoleucine, phenylalanine, lysine, methionine, leucine, tryptophan, and valine. PVT, timhol. Non-essential amino acids since non-essential lang yun siya because you don't need nga mo take through diet since our body can produce by the body. So most common is the alanine and arginine. Conditional amino acids pa siya. Conditional lang siya. So pwede siya take through diet or our body can produce. So ang example ani is kaning arginine, cysteine, glutamine, tyrosine, glycine, proline, and serine. So, but the most important thing that inyong remember is the non-essential and the essential amino acids. Mugawas na sa board exam. So, mauni ang atong most common example mga amino acids guys, the astimine. So, mo provide siya essential amino acids and energy. So, mauni ang ato ang amino acids na contain siya og sorbitol. So, astimine S man din na siya sa una, karon astimine C. But contain niya siya 5% sorbitol. Dionotrilone SN5 contain gyapon ni siya sorbitol. This promote protein synthesis and wound healing, retaining fluid in the colon, and it is treatment for negative nitrogen balance and occasional constipation. Most common use po ni sa ato sa hospital, Notrilon. Next is Nutrimine. It contain also, mao ni ang mga amino acids na anato na contain siya og mga sorbitol, castimine, Notrilon, Nutrimine, and kaning atong nutrimine contain siya essential and non-essential amino acid plus sorbitol. Next is aminoliban. Contain gihapon siya og essential and non-essential amino acids plus carbohydrates, fats, vitamins, and minerals. And mao ni siya ginagamit sa mga patients nga with liver impairment o mga hepatic encephalopathy and corrections of amino acids imbalance due to liver failure. Mao ni ang ginagamit aminoliban. Rinapod tay fermin. I know ka familiar na mo ani contain gyapon ni siya og sorbitol, amino acid plus sorbitol. Then kani aminosteryl infant wala ni siya kuan sorbitol. So mo ni is it is an organic compounds that are changed together to form protein. So this promotes nitrogen balancing in the body and also the protein reserve and protein. So first scale, is an essential amino acid, and this TPN without provide electrolytes lang. Then monofliccid provide a source of colors and essential fatty acids in adults and pediatric patients, mga preterm units, and essential colors and essential fatty acids for parenteral nutrition when oral or the enteral nutrition is not possible. So we have also the plasma expanders. Plasma expanders is a colloids. Ato na nang topic ganina. Example nga na nato is Voluven haze. So, plasma expander, the mechanism of action is to increase the oncotic pressure of plasma, which can promote water retention of water within the bloodstream and thereby can maintain or increase the blood pressure to counteract the blood loss or the shift of water from blood to tissue compartment. So, uses niya muna ng plasma expander gamit niya siya sa mga hypovolemic shock. Ang Voluven haze. So, volubenase, it is the hydroxyethyl starch, plasma volume substitute, and pwede po siya prophylaxis for hypovolemia. Restore blood volume when you have lost blood, when other products called crystalloids are not considered sufficient alone. So, ang kuan na aning volubenase ay infusion only. So, from your body. So, mo ni ang tambal sa mga cerebral edema, kananay mga like na accident, then sa abot na sa ulo nga nag-swell, mao ni ang gamito nato mannitol. It treats swelling from the heart, kidney or liver disease, treats swelling around the brain or in the eyes. So iyahang mawa man good is osmotic agents through decreasing the ICP in the brain, the intracranial pressure in the brain. Napod tay calcium gluconate. So, ang uses ani is manage hypocalcemia, cardiac arrest, and cardiotoxicity due to hyperkalemia or hypermagnesemia. So, it is um, hyp- hypertonic. It's to replenish plasma and salt in your body due to certain conditions. Yourself in your market induce and others are going surgery. So it also relax and ensure that undergoing surgery. Next is the charcoal. If nakabantay mo, you have to take charcoal. It is a universal antidote and its mechanism is absorb, not absorb, add and injected toxins within the gastrointestinal tract, preventive systemic absorption. port. Ayaw lang kalimtin ninyo ang mga color sa mga most common use sa mga IV fluid. Color, the essential and non-essential amino acids, the uses of amino acids, the hypertonic, hypotonic, and the isotonic. Some common examples and examples of crystallized and colloids, and ito ang most common use mga TPN. Ayan lang yung kalinti guys. And question lang, i-open lang ninyo ang microphone guys. Wala.
Excuse me, ma'am. Koan, ma'am, kanang medyo, I don't know if sa ako alang nga end, ma'am, pero medyo choppy jud siya, ma'am, tas nawala ang kato presentation, ma'am.
Okay.
Guys, choppy sa inyong end? Or ako alang?
Yung Shopee, ito silang Ma'am Cave.
Ako daw ikan.